What is MERS? Middle East Respiratory Syndrome is a severe respiratory illness that happens from a type of coronavirus called mers-cov. Experts first saw MERS in Saudi Arabia in 2012. The illness has similar symptoms to COVID-19, but it's not as contagious. How common is MERS? The World Health Organization has recorded 2,519 cases of MERS as of January 2020. While 27 countries have had cases, 80% of the infections are in Saudi Arabia. Researchers believe that 3 or 4 out of every 10 people with MERS have died. But this might not be fully accurate because a lot of mild cases are undiagnosed. So far, there have only been 2 cases of MERS in the United States. They were both healthcare workers who had traveled to Saudi Arabia. What are the causes of MERS? MERS may have come from bats and then spread to other animals before it spread to humans. Experts believe that it first spread to camels, which then spread it to people. The mers-cov virus lives in your respiratory tract. Like some other infectious diseases, people spread it to others through coughing. You can also get the infection from camels. In Saudi Arabia and nearby countries, camels have the same strain of MERS as humans. This shows that there's been transmission between camels to people. While it's contagious, MERS doesn't spread as fast as COVID-19. So far, experts haven't seen any community-wide spread of MERS. What are the symptoms of MERS? You may have no symptoms with MERS, or you could notice mild side effects like a cold. Sometimes, people get severe symptoms that could be deadly. In most cases, individuals will experience respiratory symptoms such as fever, cough, and shortness of breath. Additionally, MERS can cause non-respiratory symptoms like diarrhea, nausea, and vomiting. These symptoms typically appear within 2 to 14 days after exposure to the virus. Who's most at risk for MERS? While anyone can contract MERS, it is more prevalent among people living in or traveling to the Arabian Peninsula, including countries like Iran, Iraq, Israel, Saudi Arabia, and Syria. Those at higher risk include individuals who have been in close contact with someone who has traveled to this region and fallen ill, those near someone with a confirmed case of MERS, people who have had direct contact with camels or consumed raw camel meat or milk, and healthcare workers who have been in close contact with a MERS patient without adhering to infection control guidelines. Most fatalities from MERS occur in individuals with pre-existing medical conditions that weaken the immune system. People with cancer, diabetes, and chronic lung, heart, or kidney diseases are at a higher risk for severe infection. What are the complications related to MERS? With MERS, you can develop other issues too. Sometimes the infection gets worse and leads to pneumonia, respiratory failure, or kidney failure. If you have breathing issues, you might need to use a mechanical ventilator. You're more likely to develop a severe case of MERS if you have other health conditions that affect your immune system. How do doctors diagnose MERS? When suspecting MERS, your doctor will begin by discussing your medical history, particularly recent travel and exposure to sick individuals or camels. After assessing your symptoms, your doctor will conduct several lab tests to determine if you have an active MERS infection or have had one in the past. These tests may include obtaining samples from both the lower and upper respiratory tracts. For the lower respiratory tract sample, fluid from your lungs will be collected through coughed-up sputum or by inserting a thin, flexible tube into your lungs. Similarly, an upper respiratory tract sample may involve swabbing the inside of your nose or upper throat. In addition, a serum sample will be taken from your blood and centrifuged to separate the liquid part known as serum from the blood cells and platelets. However, not all laboratories are equipped to conduct mers-cov tests. In such cases, your doctor may send your samples to a state health department or the Centers for Disease Control and Prevention for testing. How is MERS treated? There aren't any approved treatments for MERS. There's also no vaccine for it. Your doctor will instead treat and manage your symptoms. If your symptoms aren't intense, you can stay at home and use medications to feel better. They'll help treat your pain and fever. But if you have a more severe MERS case, you might need to go to the hospital. During your time at the hospital, you may need IV fluids, mechanical ventilation, or supplemental oxygen. How can you prevent the spread of MERS? MERS is a rare disease primarily transmitted through travel to the Arabian Peninsula or close contact with an infected individual. If traveling to this region, it's essential to follow preventive measures similar to those for other respiratory infections. Avoid touching your eyes, mouth, or nose and maintain distance from sick individuals. Cover your nose and mouth when sneezing or coughing and wash your hands frequently. Regularly disinfect surfaces and follow special precautions if working or interacting with camels, including washing hands after contact and avoiding sick camels. If diagnosed with MERS, it's crucial to take immediate steps to prevent further spread. Stay at home, maintain good hand hygiene, and isolate yourself from others. Use a face mask when in the presence of others. Cover your nose and mouth when sneezing or coughing, and inform your doctor promptly for testing and guidance. Early intervention can help manage the illness and prevent transmission to others. How is MERS transmitted? Like some other infectious diseases, mers-cov is present in your respiratory tract. You transmit it through coughing. MERS is contagious. However, it does not spread quickly, unlike COVID-19, which spread rapidly around the world. MERS transmission requires close contact, such as between family members or in a healthcare setting. Health officials have not observed community-wide spread of MERS. You can also get MERS from camels. In Saudi Arabia and surrounding countries, camels have strains of MERS that match human strains. This suggests active transmission of MERS from camels to people. How can I prevent spreading MERS to others? To prevent spreading MERS to others, it's important to take proactive measures if you suspect you may be infected. Firstly, stay at home and isolate yourself from others. If possible, stay in a separate room and utilize a separate bathroom within your household. Maintain strict hand hygiene by washing your hands frequently with soap and water. When in the presence of others, wear a face mask to minimize the risk of respiratory droplet transmission. Additionally, cover your mouth and nose with a tissue when coughing or sneezing, then promptly dispose of the tissue and wash your hands. Prior to visiting a healthcare provider, call ahead to inform them of your symptoms and potential exposure. If your symptoms worsen, seek medical attention promptly. Taking these precautions can help prevent the spread of MERS to those around you. When can I resume normal activities? If you're feeling better, talk to your healthcare provider about when you can resume your normal activities. Your state or local health department can also give you guidance on how long you need to stay home to prevent spreading MERS to others. How do I protect myself when caring for a person with MERS? If you are living with or caring for a person diagnosed with MERS, health authorities advise taking extra precautions to minimize the risk of transmission. When in contact with the individual's body fluids or secretions, it is recommended to wear a face mask, gown, and gloves to prevent exposure. Additionally, wear gloves while handling and washing dishes, towels, bedding, and laundry associated with the patient. After removing the gloves, ensure to wash your hands thoroughly to further reduce the risk of spreading the virus. These additional measures are essential for protecting both yourself and others from MERS transmission. What is the prognosis for people with MERS? You are unlikely to contract MERS unless you travel to the Arabian Peninsula or come into close contact with someone who has recently traveled there and has symptoms. If you do get MERS, you have a high risk of developing severe disease, especially if you have existing health conditions. Your healthcare provider will monitor you closely and provide supportive care to manage your symptoms.